Hi friends, ERCP or MRCP? This is a very common question coming to a student's mind. What should we go for, whether ERCP or MRCP in a case of gallstone? So let's try to first understand. In a case of simple gallstone, there is no need to go for further investigation. You can just plan the management. So what do you mean by simple gallstone? Simple gallstone means where you have a stone limited to the gallbladder. The ultrasound suggests there are stones in the gallbladder. CBD should be normal diameter. So if CBD is normal diameter, there are no intrahepatic biliary radicals channels dilatation. So there is no dilatation of biliary channels inside the liver. There is no CBD dilatation. There is no evidence of jaundice in the patient. There is no evidence of any rise, any abnormality of the enzymes, especially alkaline phosphatase. Then we say that this is a simple gallstone. So in those cases where we are dealing with the simple gallstones, no need to further investigate the patient. We can directly plan for management. Now comes the role of ERCP, MRCP. When is the role of ERCP and MRCP? ERCP and MRCP in a case of gallstone is done only in those circumstances where we are suspecting that a stone has slipped into common bile duct. So what are the indications? The indications are, if an ultrasound you find dilated CBD, if an ultrasound you're finding that there is intrahepatic biliary channels radical dilatation, if on the liver function test patient's direct bilirubin is a little bit high, patient's alkaline phosphatase is high, or patient is having evidence of jaundice. In these circumstances, we are going to plan for either ERCP or MRCP. So when to do MRCP, when to do ERCP? If our suspicions are very strong, or if our evidences are very strong, like if the radiologist write, ultrasound shows gallstones, multiple gallstones, dilated CBD, and a small stone seen in the common bile duct. So there is no confusion here. Here we can directly plan the patient for ERCP because we have to remove the CBD stone first. In those circumstances where evidences are not very strong, where we are just suspicious, like ultrasound shows gallstones with slightly dilated CBD, no evidence of CBD stones seen, slightly high alkaline phosphatase. If these are the circumstances, or if the patient gives you a history of jaundice in the past, obstructive jaundice in the past, in these circumstances where the suspicions are not very high, in those circumstances we should go for MRCP first. Now what is the reason? The reason is MRCP is just investigative. It's not a therapeutic, and it is not an invasive procedure. So our aim is first to confirm the diagnosis. Now if the MRCP shows yes, there is a stone in the common bile duct, then we have to go for ERCP next. Yani first we have to do the MRCP in those cases where our suspicions are not very high, and then we go for ERCP to remove that stone. Now why do we do this? We do this because ERCP is an invasive procedure and it is associated with some complications like pancreatitis, inflammation of the pancreas, cholangitis, bleeding when we are making a cut on the ampulla, or even sometimes duodenal perforation. So I hope the question is clear. ERCP when there is a clear-cut case of CBD obstruction by stone. MRCP when you're just suspicious and evidences are not very strong of a CBD stone. Then we go for MRCP first, and if there is a stone, then we go for ERCP. Thank you.